Okay, so today I'm going to be doing a chest tube dressing change because according to my hospital's policy that should be done every 2 days, and my patient received this chest tube about exactly 2 days ago. So according to the doctor's orders, which I have checked, this is the appropriate time to do this procedure. So I have already looked at my patient's labs and I know that they're not on any anticoagulants, so I know that there isn't that extra risk of increased bleeding when I'm doing this procedure. My patient already received analgesics about 30 to 40 minutes ago, so they should be kicked in now because this is quite a painful procedure. The skin underneath is quite hypersensitive and I'm going to be kind of cleaning in there, and it's going to be quite uncomfortable for my patient. So they've already received their analgesics. I've checked the 4Bs. My patient's brakes are on the bed. The bed height is low, they already have their call bell within reach, and the bed rails are up on the opposite side to where the chest tube is draining. I want it that way so that when they need to mobilize and get out of bed, they're not pulling at the chest tube and dislodging it. So that's good. I have an unopened bottle of normal saline at the top of my patient's bed. This is just in case that seal breaks or there's break in the system, and I can just take the tubing and put it in the normal saline to maintain that underwater seal. I also have 2 Kelly clamps at the top of my patient's bed for in case of emergency if I need to clamp the tubing, and I also have 2 occlusive dressings, again in case of emergency. My patient's dressing is dry and intact. That looks good to me. I've checked the oxygen and suction in their room. Oxygen's working in proper levels. It's ready to go. The suction is no more than 80, and which the suction on their chest tube is -20, so that's proper. And so I've already entered my patient's room. I've done their PPID. I know I'm working with Kelly Boyd. I checked her birth date and her MRN and the spelling of her name compared to the electronic medical record. So that's good, and she has given me her spelling of her last name, first name, and her birthday, so I'm confident she is who she says she is. Next, I would have done a respiratory assessment. I would have listened to all the way to the bases, listening for crackling and gargling sounds. I'm looking at my patient's trachea, making sure that it's midline. If it is not midline, that would indicate a tension pneumothorax, which is life-threatening. I've palpated for subcutaneous emphysema to make sure that I know the size and shape of it. And I've checked my equipment. I know that the chest tube system has a little bit of bubbling happening, which means that it has that underwater seal, and there's tidling happening when my patient is breathing in and out. And there's also no dependent loops in my patient's chest tube. So I'm ready to go do this dressing change. Like I said, I've already checked the old dressing and it's dry and intact. So we're good to go. Okay, so first thing I'm gonna do is wash my hands. I'm gonna put on a mask to maintain sterility throughout this procedure. And while I'm opening up my dressing tray, and clean gloves to open the dressing tray. Okay. So I've got a major dressing tray here that I will be using today. Grab the forceps. Okay. Might need that for later. Garbage. Good. Okay, so I want to add some things onto my sterile dressing tray. I want to add 2 non-woven sponges. One I'm going to be putting on top of my drain sponges on top. Last thing I will put on before the me-fix. And then I want to put in another one just in case I need to be holding the tube at any point during the cleaning or anything like that. Next, I'm going to be putting in those drain sponges that are going to wrap around the tubing. And finally, I'm going to be adding in my chlorhexidine swabs. And I want to be using chlorhexidine only swabs because the ones with alcohol, there's a risk of breaking down the tubing, the plastic tubing. So I want to use swabs that are only chlorhexidine. And this was all new equipment. Okay, so I've got everything in my sterile field. Happy with that. I'm not going to put my Mefix in because it's not sterile. And I think I'm ready to take off my patient's old dressing. So, my patient today is a save-a-day tray with a tubing out of it. What I'm going to be asking of my patient, Kelly Boyd, is to please look away or wear a mask while we're doing this procedure so neither of us are breathing into or onto the surface that we're cleaning. So, going to remove the old dressing. My patient has her mask on. Just going to peel up the edges. I'm using my clean gloves to do this because if I wear my sterile gloves, they won't be sterile anymore. Being as gentle as I can. And I'm not touching inside where the dressing is. Okay. Just removing all the old dressing. My patient might be in pain during this, so I'm trying to go as quickly as I can. Okay, now it's exposed. So I'm going to work quickly but carefully while I'm doing this, getting on my new gloves. Looking at the site, I don't see any redness or swelling. It's good. I'm going to put on my sterile gloves. Oh, my pinky's stuck. There it is. Okay. Okay. So, don't need this. I am sterile now. I can touch inside my tray. So the first thing I want to be doing is cleaning. So I'm going to grab my chlorhexidine swabs. I'm going to use the sterile side and I'm going to do a zigzag motion, working out away from the insertion site. And I'm going to do it the width of the dressing. Now I'm going to go to a clean side, or the sterile side, the other side of the chlorhexidine swab. Doing the same thing, working back and forth. And I'm not leaning over the insertion site. It's moving towards me because it's on a smooth table. So now I'm going to do same thing on top. Zigzag motions, back and forth, working away from the insertion site, the size of the dressing. Clean side again, or sterile side. Back and forth. And this tubing is already up, but if I had to, I could use my 2x2 swab to hold it up out of the way if I needed to. So now I've done two. I'm going to do my final one. I'm going to do, starting at the base here, I'm going to do circular motions. Working up the tubing. Perfect. Okay. So I don't need to use any skin prep or anything like that. So we're going to get going with the drain sponges. So I'm just going to place this one around there. And I'm not touching anything. I'm still sterile. I'm not touching anything that's not sterile, I guess I should say. So I'm going to use my forceps to help me out here to maintain sterility. trying to pull this around. There we go. So I don't need those anymore. I'm going to be putting 4x4 on top. And now my things, my dressing and insertion site are all covered up. So the last thing I'm going to do is use my Me-Fix. I can break my sterility now, it's all covered up. So I'm grabbing my Me-Fix. I'm going to cover the whole site. And working away. There we go. And I'm going to want to be occluding this drain here, the tubing. So I'll just leave that up for a second. And I'm going to be doing the other side. And they're overlapping. I've got about a 1-inch border here, which I'm really happy with. And then I'm going to do my final step, which is occluding around the tubing. Again, I'm no longer sterile. This is all in place, so that's okay. And this is all occluded to prevent any air from getting into the space. And I'm going to put my initials on it. Ideally, if I had a sticker, I'd put it on top of the sticker, but I'm going to do JL. Time is now 10:45 a.m. And I'm going to put the date is December 4th. And there we go. Thank you so much.